This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle and the Roselle Center for Healing present Ageless Health 2014, Proven Tools to Maximize Your Health, Saturday, October 18th at the Fairview Park Marriott in Falls Church, Virginia. At this all-day seminar, learn how you can feel better or feel great when the doctors from the Roselle Center for Healing each discuss a topic that directly affects your health, like your food, physical fitness, preventing injury and disease, your healing process, and more. Learn more at agelesshealth2014.com. That's agelesshealth2014.com.
Dr. Tom Roselle live right now on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. I'm live in studio. It's beautiful outside, absolutely stunning, but you have to listen to me first. 888-630-9625, 888-630-9625. That's how you find me. That's how we talk to each other today and ask me any questions that you may have on your mind, things that have happened to you, and you don't know which way to turn. Well, here's an opportunity to find out which way the application can be without drugs, without surgery. That's what we talk about on this program. We're here to serve you in every way that we possibly can. Have a lot of things that I want to share with you today, but I also want to share your thoughts. But, you know, if you pay attention to the news, there's things that make you wonder, well, is that really true? Not really true. Well, we're going to talk a little bit about cholesterol today, and just for a short little bit, because I want you to understand some of the information that is duping you, so to speak, things that you're believing and buying into and getting things way out of control because of the medications and the directions that you've been told. Not a good thing. But we're going to talk about things in the news and things that you know about. Interesting article recently that just came out, and it was published by the Journal of Clinical Endocrinology. Now, these are the allopaths out there that specialize in looking at your internal organ systems. It's always bothered me why we have to isolate the body. We look at the thyroid, we look at the heart, we look at the intestinal tract and the kidneys and so forth, and we forget that they're interrelated and integrated into everything else that goes on in your body. So when we say your heart has a problem, my brain goes, well, what about the other things that influence the heart? So this is, let's talk about endocrine system a little bit. Anyway, they were talking about vitamin D, and you've heard me many times talk about D, and the article appeared quite recently, within the last several months, and it said that deficiencies in vitamin D increases your inflammatory levels, and particularly in older men and women, indicating that their immune system is compromised. Gee, go figure. How many times have we talked about that? How we said that, if your inflammation levels are high, but vitamin D is not the only culprit here. But let's talk about that, because you've heard me say that the majority of you, probably in the neighborhood of 75 to 80% of you living in this area of the world, meaning the greater Washington, D.C. metropolitan area, are very deficient in your vitamin D levels, and they can cause problems. Well, one of them we know that is immune function. They did a study, small study, but they did a study. And the study included about 480 plus guys and 470 some women. And they, they did this study, they monitored them and so forth. And they looked at the development of disease factors over a period of time, but the age group were people above 60 years old. And the blood samples showed certain things. And what they did is they looked at vitamin D. The study showed that the 25-hydroxy vitamin D3 levels were not where they should be. Inflammatory markers that they used were coronary C-reactive protein. And then they actually did a tumor marker. And the tumor marker was something called interleukin-6, or what we call IL-6. Now, that all by itself is significant, that they would actually do a study that combined all of these things. And they actually threw a couple other things in there. There was some also some alpha interleukin markers. And, I said, wow, this is, not too bad. But research showed that when there was a decrease in interleukin-6 and coronary C-reactive protein, and that there are certain ratios that need to be maintained in the body, that it was directly associated with in this study of vitamin D problems. The data went on to suggest that vitamin D might be involved in maintaining the health of the immune system. Well, if you've been listening to me, particularly with the musculoskeletal system, if you don't have a high level or adequate level of vitamin D3 in your body, your musculoskeletal system is going to be compromised. You're going to hurt. You're going to go into degeneration. You're going to lose bone mass. But your immune system, that system that fights and protects and keeps inflammation down, is also going to be compromised. Subsequently, guess what? You got a problem. So we can get into that as we have in the past. But the mechanism proposed in this situation is been well known for a long time, and it just kind of blows my mind that the traditional conservative allopathic community is just finally getting a heads up on this when it's been around forever. Hey guys, listen, I got one for you too. All of us are suffering with problems with prostate cancers and so forth, the potential of. We don't necessarily have them. So what can you do about it? Well, the National Cancer Institute came out with another flag and said, hey, guess what? There's a protective element. It's called lycopene. And if you've read any of the nutritional journals for years, you know that lycopene, which is a carotenoid, by the way, it shows up in all kinds of red pigmented foods, particularly tomatoes. If you have enough lycopene in your body, your risk of developing prostate cancer actually decreases. And who came up with this brilliant finding that's been out there forever? Well, Harvard researchers. Wow, let's applaud them. And they actually did a very, very broad-based study. They looked at almost 50,000 men, and these were professional guys, and they did dietary questionnaires, and they were completed, and it was analyzed for lycopene intake. Well, prostate cancer cases and deaths associated from prostate cancer disease was looked at over a period of actually quite a significant period of time. It was about 25 years. And here's what they came up with. They said men whose lycopene intake was among the top 1/5 of those guys that were participating in the study had a 28% lower risk of prostate cancer compared to everybody else that was out there. Wow. Guess what? We know that. And, the risk of lethal prostate cancer was examined. Those in the highest intake group experienced a 44%. That's like 50% almost, right? Yeah, that's my math. That's, Dr. Tom's math of developing a deadly form of the prostate cancer. That's significant. That's like amazing. So if that's true, guess what? There's little things that you can do to make a huge difference. But that's just one thing. You add that to vitamin D, and guess what? Your risk of developing cancer even decreases even more. We know that for women with estrogen-based types of cancers. And here's the deal that we've talked about for such a long period of time. Prostate and breast cancer are typically associated with estrogenic imbalances. Why? Because the prostate tissue and breast tissue are the same genetically. So if women have an increased risk because of an unbalanced estrogenic exposure, then guys, guess what? Unfortunately, you too. And we've talked about the fact that we're seeing 2 to 3% of all breast cancers now are male, which was unheard of before this. Why? Simply because of the fact of our xenoestrogens and the fact that we're being exposed everywhere we turn around. If you drink water out of a plastic bottle that is a BPH problem, guess what? Your risk of estrogenic exposure just went up. And we can go on and talk about all kinds of things, but I have other pieces I want to talk to you about today. 888-630-9625, 888-630-9625. Love to talk to you. Want to remind you and put this date away, and if you haven't taken action on it yet, you need to take action on it now, today, immediately. October 18th, Ageless Health 2014 is coming up faster than you can imagine. It's our 13th production of this amazing day. And what do? Well, we're going to present from early in the morning to about 5 o'clock in the afternoon, and we're going to give you more information than you can possibly understand that is possible in the area of integrative and conservative care. And you can go home that day, that night, and put it together. We start out in the morning while you're registering for this presentation, and you're going to learn how to do core training type of exercise no matter where you are, sitting, standing, doing all kinds of things. And as we get into the session, I kick it off, and we're going to talk about the model of integrative care, structural, chemical, emotional. We're going to talk about how that works. And then each presentation is tied into the next. We're going to talk about nutritional patterns. We're going to talk about energetic patterns. We're going to talk about body mechanics and neurology, and we're going to talk about how to prevent dementia, and we're going to tell you about the type of laboratory testing that's necessary. This is all designed as tools you can use to help yourself, and you need to know. We break midday, and we'll have some vendors. We'll show you some of the things that are available in the integrative care marketplace. Then we're going to break for lunch, and we provide lunch. We supply the lunch for you, all for the price of your ticket. Organic lunch, and then the Chinese Martial Arts Institute is going to do a beautiful presentation on Tai Chi, the Kung Fu-based Tai Chi. It's a gorgeous presentation. If you've ever seen it before. Get back into the afternoon, and then we're going to break again. And then I'm going to end the day, and I'm going to take you through step by step by step and how to put this stuff together so it's in a usable format. So you can do it now, not tomorrow, not with more guidance, and you'll have all the notes. And each one of you who register, by the way, will be registered for a drawing that is worth $1,000. So how do you do that? You go to our website. You go to Roselle Care. That's ROSELLECARE.com, rosellecare.com, and you're going to scroll down about halfway through the page, and you're going to see, boom, it's there. And you're going to register, and you're going to register now. And why are you going to do that? Because you're going to save a lot of money. The tickets are inexpensive to begin with, but if you register now, you're going to save a bundle. It's only $59, and that includes lunch for the whole day. Trust me, we're losing money on this, so take advantage. Make me lose money. Show up, learn, because I'm here to dedicate my life to you and to help you in any way that I can possibly can. Get it done. And if you need any more information, you can always go to rosellecare.com, or you can, guess what, call us at the office, 703-698-7117. And how you find me here today is 888-630-9625. Let's talk about cholesterol. And I'm going to put it this way. Cholesterol scam. Cholesterol scam. What's that all about? You're duped. You know, if you're like me and many of us, you've come to realize that everything in this country is about money, power, politics. That's all it's about. You know, who's got the biggest buck and who needs to, position themselves as, sometimes a fake leader, right? But you need to understand it's about money. It makes little difference, really, who's elected in government. I've become very cynical over the time because people will do almost anything to gather and maintain money and power. And let me qualify that and say evil people. And not everybody's evil, but there are evil people. That includes creating scams to, dupe you and me, the common guy that's out there, the guys that aren't in the power positions. And what they need to do is they need to pay somebody else off who's on, help them by patting their pockets on the way up the ladder. So if I'm a little cynical today, you're right. If I'm a little over the top because of some things that I've been involved in recently and read and kind of upset about them, that's where this is coming from. They've successfully managed, these guys in power, they've successfully managed to circumvent even our U.S. Constitution. And how do they do that? At the end of the day, guess what? You pay for the scams, and you pay for it with your money, your health, your wellness, and guess what? Your life ultimately. And that's not a good thing. That's why I do what I do. That's why I'm dedicated to making sure you understand how to take care of yourself. That's the name of my book. Remember, Ageless Health? Health is a do-it-yourself program. You have to understand that you have control because nobody else is going to take control in a beneficial way for you. So you have to educate yourself. You have to be in the driver's seat. You have to be in the pilot's seat. If you don't do it, shame on you. It's something that you're letting somebody else do to you. Not a good thing. We're going to talk about this scam. I want to get into it a little bit more, and we want to talk about specifically about the one piece, cholesterol, and nothing else, because it's a multi-billion-dollar industry, and it's something that you have to be aware of. We're going to talk about the truth about cholesterol and how do they do it, and we're going to talk about exactly what you need to consider as you're moving forward. Real simple things, but you're going to get the idea that I'm irritated, that you need to take control, that you need to step up the plate, and if you don't, you know what? I'm afraid for you. I really am. We'll be right back after some very important messages, and when I come back, I'm going to surprise you with a couple things. Don't go away. This is Dr. Tom Roselle.
Dr. Tom Roselle and the Roselle Center for Healing present Ageless Health 2014, Proven Tools to Maximize Your Health, Saturday, October 18th at the Fairview Park Marriott in Falls Church, Virginia. At this all-day seminar, learn how you can feel better or feel great when the doctors from the Roselle Center for Healing each discuss a topic that directly affects your health, like your food, physical fitness, preventing injury and disease, your healing process, and more. Learn more at agelesshealth2014.com. That's agelesshealth2014.com.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio, 888-630-9625. That's how you find me. That's how we talk. Talking about things that you need to be aware of. And we're talking about scams, money, power, and position, and whose pockets are getting padded, and we're going to get back to that. We're talking about it specifically when it comes to cholesterol, but if you listen to the program over a period of time, you know that, I'm not the greatest fan of Big Pharma and how they manipulate, they advertise, they promote just to try to get you to take their stuff, and all of you go over and think that, the magic pill is going to serve you instead of taking control of your own health, your own well-being. Well, we're going to talk a little bit about that today, but first, let's go to the phones. Henry from Culpeper, how can I help you, sir?
Yes, thank you, Dr. Tom. I've got a bad case of eczema.
Where's it look?
Pardon me?
Where do you got it on your body?
It goes from my shoulders to my hands and down my back.
How long has it been there?
It's been there a couple of months.
Okay. So what's different in your life, your exposure, that you got this? Is there anything on your chest? Is there anything around your waistband? Anything on your legs at all?
It's around my waistband and nothing on my chest.
Have you checked?
I've been exposed to dry heat all winter.
Okay. Well, we're in a time of the year right now that shouldn't be an issue. It should be going away, but there's a couple things that come to my mind. Remember that any type of eczema is usually one of two situations. It's either a contact problem or it's a reflection of what's going on inside your body. Your skin is nothing more than a mirror of your internal mechanism. So, for example, if your intestinal tract or your digestive system isn't working, then your body starts developing sensitivities to all types of things, and it actually will get into your skin, and you'll see it into different types of patches, incrustations, and the like. However, one of the more common things, believe it or not, that will cause an eczema type of reaction, a redness, an itchy, a dryness type of presentation, is if you change any kind of soap that you're washing your clothes with. And, years ago, for example, when I was very young and I was still in high school, my mother changed from something to Tide, and that was, many years ago. I got so sensitive to it that I basically had to rip my clothes off of me. But that's one of the things that you would look at. You'd look at your environment. What's different? Do you have your air conditioning ducts now working where they weren't working before, and maybe they're dirty and they're not they're exposing you to things? Are your clothes being washed in something differently? Are you eating things right now that you hadn't eaten before? Are you putting on any kind of lotions on your body that weren't there before? Are your bowels working where they haven't worked before? Generally, back type of problems also are toxic reactions that have to do with the liver not working as cleanly as you'd like it to be. So I would do something very simple. Take away anything that that's a major irritation. Make sure you're drinking tons of water. calendula cream, calendula. Calendula cream is something that you can put on without too much of a problem, and it gently decreases sea breeze if you pick it up. If it's something that's really irritating you right now, you can put that on your skin, and that will help as well. Dead sea salt baths, getting in there, that will decrease the irritation to it. You can actually make a basin of water, kind of tepid water with dead sea salt in it, and soak a washcloth and just kind of gently pad your skin. That will take some of it away as well. But anything from mites to detergents to metal exposures, fumes, fertilizers that are outside, if you're working outside, any of those things can trigger these things. If I had a picture of you, I could tell you a little bit more. But stay away from things like steroids and immunosuppressors that medical people like to do, because that just makes things worse. It makes you much more sensitive and receptive to these types of things. I hope that helps a little bit. If you can send me a note on drtomroselle.com or rosellecare.com, and we'll see if we can get a little bit more specific. Henry, thank you very much. I appreciate it. We have several people online, and I'm going to get to you, and I want to answer your questions because I'm finding some very, very interesting topics out there today. But we want to get back, and we want to talk a little bit about this craziness, this scam, cholesterol, right? Everything's got to be cholesterol-free, and, you've got to keep your fat levels down and so forth and so on. Well, the problem is when your cholesterol gets too low, so do your hormones, so does you increase the risk of different types of heart problems and plaquing, and it's actually what you're trying to avoid is what shows up. And your vitamin D level is actually controlled by cholesterol. So a lot of you that are on statins, guess what? Your vitamin D is going to go right down the tubes. And we're going to talk about why that is when we come back from a break. It's going to be a short one, so don't go away. You're listening to Dr. Tom Roselle live, and I'm trying to make this a beautiful day for you.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I'm in studio, 888-630-9625, 888-630-9625. Love to talk to you on any subject. We've got a whole bunch of things that we're discussing. We're going to get back to the cholesterol scam, if you will, in a second or two. But first, I'd like to go to the phones, and because you guys are sitting there very patiently. Richard, calling from Dumfries. How can I help you, sir?
Hi, Dr. Roselle. I love your show.
Thank you. Appreciate that.
What do you think of a 62-year-old male, namely myself, taking progesterone as one resource in hypertension control?
Well, what you're dealing with, if you're taking progesterone to control any kind of blood pressure problem, it's because all your hormones are off due to an inflammatory reaction. So what you're having to do is substitute it. Progesterone in men is as necessary as progesterone in women, and because it counteracts the balance of estrogen. And when you're estrogen dominant, you end up with all kinds of very, very unpleasant symptoms, including increased risk of cancer. In a guy, progesterone is converted to testosterone, and it should be. And it should go to good testosterone, not DHT, and it shouldn't be sidetracked into estrogen, meaning estrone and estradiol. So those are the paths that it can go, but you've got to take the step back from that. So if we have low progesterone in a guy, then we're going to see things like prostate problems. Prostate's going to swell, urinary problems, inflammation goes up. We can end up with all kinds of heart problems, fatigue, depression, hair loss, but not like mine, where it's a genetic pattern. Impotence, just no, there's no interest whatsoever. The whole idea is to try to find out where it's coming from, but blood pressure problems can come about, but it's an indirect situation, and I wouldn't treat a blood pressure problem with progesterone. I'd try to find out what the adrenal, the fight-flight system is doing, because you produce, as a man, you produce progesterone in two places. You produce it in the testicles, and you produce it in the outside, the adrenal cortex. And if it's testicular, then you may not be getting the signal from your pituitary. Your pituitary releases something called LH, which is luteinizing hormone, which triggers the testicles to release testosterone and to release progesterone and to release other hormones. Your fight-flight mechanism, your adrenal cortex, produces all those things as well in trace patterns. So when you're stressed, and meaning stressed structurally, chemically, emotionally stressed, you increase your inflammatory response throughout your whole body. And first you get this wall up, this invincible, barrier called inflammation, and nothing can transport through. So your body goes into a fight-flight reaction and tries to produce more, and pretty soon everything gets tired and nothing works. So does progesterone work? In very balanced levels, and you have to be very careful, and it has to be a natural form of progesterone. That's not where I would start. I would be looking at the different mechanisms. I'd be looking at the nervous system. I'd be looking at the energetic system. I'd be looking at the dietary patterns. I'd be looking at the stress patterns, and then try to put those things back into an equilibrium. Because at 62 years old, under the way your body was designed by your Creator, it's not meant to break down. It only happens because of very specific things that happen over time. So. Right. Yes, I've heard, to answer your original question, yes, it's been used, but that's not the approach that I would take.
Okay, and is there a specific chiropractic adjustment that my chiropractor can do to help with blood pressure? I've heard that there is. Yes,
there's a lot of different things that can be done. The craniosacral mechanism, the skull bones, you've got 22 bones that make up your cranium, and they move as you breathe in and out. So what happens is like a tongue and groove. And as you breathe in and as you breathe out, what they do is they act as a pumping mechanism in reciprocation to the sacrum, that wedge-shaped bone at the bottom of your spine. And it pushes it up and it pushes it up. But sometimes because of injuries, blows, because of sneezing improperly, because of bad dental work, the cranial plates lock. And so subsequently you get this buildup of spinal fluid. Same things with glaucoma and so forth. Those are increased pressure syndromes. And if the system is treated properly and you get that craniosacral mechanism to work the way it's supposed to, guess what happens? Pressures go down all through the body. The upper part of the spine, thoracic 1 and 2, control the lung and the heart. Often when those areas aren't working the way they're supposed to, then the cardiovascular system is not going to respond properly. The middle portion, where your rib cage ends and your low back starts, that's the area that controls your kidneys and your adrenal, your fight-flight system, the thing that we're talking about now. So, right. Yes, you have to identify properly the upper part of the cervical spine, cervical 1 and cervical 2, affect the lower part of the brainstem, the vestibular area of the brain. And if that's not working, it puts a torsion on the covering of the spinal cord called the dura. So I don't know the different patterns that your chiropractor is affecting, but if he's affecting those areas and he understands craniosacral patterns, yes, he can make a huge difference for you.
Doctor, thanks a lot. I appreciate it.
You're welcome, my friend. Thanks for calling. Gary, you're calling from Southern Maryland. How can I help you, sir?
Love your show as well.
Thank you, my friend.
My daughter has a form of MS called Friedreich's ataxia, and she has a low amount of frataxin in her cells. And we just found out that niacinamide increases the frataxin in her cells by 200 to 300%. I was wondering if you knew of anything natural that she could take that might be better than that. We just found out about it days ago.
Gary, I'm not going to hedge with what I'm going to tell you, because the way you treat a patient who has MS is first try and identify what the triggering mechanism was. And you're dealing with an end pattern of the body's inability to desensitize, detoxify, balance drugs and hormones. And that's liver function. That's phase 1. It's called cytochrome P450. So you have to look at the underlying mechanism. Sometimes there's heavy metal exposure over time that's locked these mechanisms up, that has stopped the neurological triggering mechanism, the neurochemical triggering mechanism of this stuff. Again, I'm not hedging. I'm just telling you where I would look. I wouldn't give a supplement, so to speak, specifically for that, other than trying to detoxify the liver and also chelating out, getting rid of any metal that was that's in the body that's inhibiting or limiting the pattern. If you've listened to me long enough, you know that there are things that you can do and take for a cold, and you do this and try to bring up your immune system. But when you're dealing with an MS patient, we've dealt with many of them over a period of the years, you try to normalize neural physiological function in the body. And by doing that, you have to find, how is the system being impaired? Is the body detoxifying the way it's supposed to, so you decrease the inflammatory response? What's causing the myelin sheath in cases like MS and other types of degenerative neurological problems to begin to break down? Is it aluminum? Is it mercury? Is it other toxins that we're constantly being exposed to environmentally? So I would have to know more about that but phase 1 detoxification, glutamine, glutathione, high levels of vitamin B12, the hydroxy form. You have to have a ratio of 5:2, so it's not a simple, take this, right? If you can get a hold of me at drtomroselle.com, send me a note, and then I will ask you very specific questions about that, and I'll try to guide you and at least tell you what I would do if it was my daughter.
All righty.
Fair enough?
Thank you very much.
Gary, thank you for calling. I appreciate it. George, thanks for sitting there waiting. How can I help you, sir?
Hey, Dr. Roselle, I have a question for you.
Shoot.
I'm actually your guinea hen root guy, but...
Oh, okay. I thought I recognized the name.
Oh, sorry?
I said I thought I recognized the name on the screen.
My question is this. I was tested years back, and I'm talking back in 90, cholesterol, triglycerides, that type of thing. And my both of them were off the chart. The guy said, well, you should be dead in a year if you don't get these corrected. Well, I'm not really I don't like the cholesterol medication and whatever. Had my liver tested, see if I had a fatty liver, all the tests done to see if there was a reason why my triglycerides were off the chart. They couldn't find any. One doctor said it might be a natural thing. Some people just have naturally high triglycerides and high cholesterol.
How high was it?
Yeah, it's such a long time ago. I want to say it was almost 900 for triglycerides, if that's possible.
Yeah, you should. The guy was right to tell you should be dead. But go ahead.
Well,
obviously, you're not.
Might have been the guinea hen tea, but I don't think so. So what do my diet is tight. I don't eat red meat. I don't drink. A donut every now and again. We all do that. Aside from that, my diet's tight. I'm in shape. I work out 6 days a week. I just don't know what else to do. I have no intentions on going on stats.
Well, I'd need to see everything else that's associated with you. High triglycerides. Let me give you a visual. When your triglyceride levels are really elevated, it's like your blood is milkshake. It's thick, so it's having a hard time moving through the arterial system. And it's usually a result of an inflammatory process. Triglycerides have to do a lot with the inability of your body to handle sugars and carbohydrates. And when you look at that, again, you're going to go to liver, you're going to go to pancreas, you're going to go to gallbladder. It doesn't mean that you have to have a degenerative liver to have this thing show up. It just means that things aren't working the way it's supposed to. Normal triglyceride levels, according to traditional laboratory findings, are anything under 150. For my book, I like to see it under 100. I get somebody with other factors that are not good, but if the triglyceride levels are down, it's not an issue. But this is all part of something called metabolic syndrome. And it can work slowly, insidiously over a period of time. Even, dietary patterns, there's, in my opinion, other than some fruit occasionally, there's no good sugar. And there's no good starchy carbohydrates except for those that you get from vegetables and maybe occasionally some sweet potato, some wild rice in that form. Because, take a look at what happens to cows and pigs and all the cattle that we raise for consumption when they give them corn and wheat and carbohydrates and all that garbage. They get fat. And you can be a fat, skinny person. And what I mean by that is you get somebody who's, looks great on the outside, but their whole body is got a problem. But you see it with hypothyroid problem. You see it with kidney disease. You see it with people who are obese, again, inside or outside, when triglyceride levels aren't firing the way they're supposed to. There's certain medications over a period of years that will dramatically increase it. And again, this is not your problem, but I'm saying it for the benefit of our listening audience. One of the cancer drugs, tamoxifen, is known to jack triglycerides up, steroids, any of the beta blockers for blood pressure regulation, diuretics, estrogens. And talking, our last listener or caller was talking about progesterone supplementation. Well, estrogen levels that are unopposed can also cause triglycerides to start kicking up. Women who are on birth control pills. So without knowing specifically what it is, there's something called a VAP test that we do to break down fats and cholesterols into their components. You've heard me talk about really bad fats and not so bad fats, the LDLs, the HDLs, the really, really good protective HDLs, and the kinds of guys that aren't really doing much, they're hanging out. So you have to know what those are, whether they're small density or large density molecules that are kind of sticking in the arterial system. Once you understand that, and then you kind of trace it back step by step, then you can find out where it's coming from. Whether it's genetic in your particular, there are guys who have high cholesterol levels that are genetic and their arteries are clean like a baby's skin. But you have to know more. I'd have to see your inflammatory markers. I need to see your VAP markers. I need to see, really what you're doing dietarily. Are there things that are supportive for your metabolism and your genetic background and your blood type, or is it something that, Anyway, I'd love to help you. I just need to know more information. So bottom line is triglycerides that are high are never a good thing. They're telling you that there's other mechanisms that are not working. In your case, when you had that uric acid problem, the mechanism that's involved is the same organ system, at least one of them, and we're talking about liver function. Doesn't mean that you have a fatty liver, but also the other pieces, the pancreas, the kidney, the gallbladder, and so forth, have to do with it. I know that I'm not giving you exactly what you want, but I'm trying to explain it to you.
So how many battery of tests actually would be needed to find out if it still is high? And I haven't had it checked since the 90s.
Well, George, I'm not the kind of guy that's going to go on a hunting expedition. The first thing that I'd want you to do is a lipid VAP test, VAP, and I want to see a liver enzyme test. I want to see some, just a straight CBC with differential. I want to see a coronary C-reactive protein. I'd like to see a vitamin D3 test on you. Basics, and then maybe an ESR, which is a general inflammatory marker as well, and put those together and see what that. Then you would go in and you would do other types of testing based on that. But just to throw a bushel basket at you and say go do this, that, the other thing, doesn't work that way. But write me a note. You have my email. You and I have gone back and forth, and I'll write some things down that you should get done. Okay?
Sounds great. Thanks, Doc.
George, thanks for continuing to listen. I appreciate it. 888-630-9625. We're coming up to another break. This has been a fun program. I still haven't gotten back to all the things about cholesterol. I'll try to do that after the break and make sure you have all that information. Remember, I do this for you. I do this to give you the data, the information, for you to do your own homework and be proactive in your own life. Stay tuned. Don't go away. We'll be right back. This is Dr. Tom Roselle.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
Dr. Tom Roselle and the Roselle Center for Healing present Ageless Health 2014, Proven Tools to Maximize Your Health, Saturday, October 18th at the Fairview Park Marriott in Falls Church, Virginia. At this all-day seminar, learn how you can feel better or feel great when the doctors from the Roselle Center for Healing each discuss a topic that directly affects your health, like your food, physical fitness, preventing injury and disease, your healing process, and more. Learn more at agelesshealth2014.com. That's agelesshealth2014.com.
Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle Live. We're here every Sunday, 12 noon, bringing you the most intimate and updated information on integrative and alternative healthcare, from chiropractic to acupuncture to nutrition to all those things that you have a question about. That's why I'm here. That's why we do what we do. We're here to give you a path, another thought process. And remember my axiom, right? Don't believe anybody, including me. I want you to do your homework. I want you to do your research. I want you to see if it makes sense to you, or if you're being sold a bag of goods. And in this situation that we're talking about with cholesterol, and many of you are being sold a whole lot of nothing. And if I didn't bring it to your attention that it's a scam in most situations, that I wouldn't be doing my job. So what triggered this? Something happened in the office last week that really irritated me to the point of I'm looking at this poor person and I'm saying, how could anybody in a conscious state that has any kind of emotional sensitivity and love for humanity tell you what they told you? So this is why I'm doing this, okay? So here's the deal. Everything everywhere is cholesterol free. Low cholesterol, get your cholesterol down, your cholesterol levels screened, get saturated fats out of your diet and all of that stuff. And, there's so many physicians out there that now want to drop your cholesterol under 150. Unfortunately, this is garbage. It's a scam. These people, unfortunately, look at money as their God, and they'll do anything to dupe you so you can spend your dollars. The truth about cholesterol is very different. Cholesterol is a type of fat that you need. It's essential to your life. Your liver needs it. Your brain needs it. Your adrenal glands, your intestinal tract. Everything about you needs to have cholesterol at a decent level. Otherwise, you can't function. And we keep working to get the cholesterol level down. Not a good thing. If you didn't have cholesterol, you'd die. And it would just, boom, it would be agonizing. You would hurt. You would go into degeneration. Your liver makes and uses cholesterol. And it does this so it can produce bile. Bile is a way of removing toxins from your body. Metals particularly as well. Cholesterol is the core of your hormone production. If you don't have cholesterol, you can't produce cortisols and DHEA and progesterones and estrogens and testosterone. You can't do it. The more you lower your cholesterol or stop it from working the way it's supposed to or absorbing into your system, the worse many of these things become. Cholesterol is the main part of every cell in your body. You can't have good skin integrity. You can't have your body at a level where it protects you without cholesterol. Simply put, and I'm going to tell you again, most of this junk out there is a scam. It's out there to sell you dangerous drugs that don't have any benefit. These drugs have no benefit, particularly to women, and almost no benefit at all to you guys. They have a tremendous benefit to people who want to put money in their pocket in their bank accounts. Yeah, I know, I'm putting myself out there. But it's the truth. I wouldn't tell you if it wasn't. I wouldn't tell you if the documentation wasn't there. It's the truth. So what's a healthy cholesterol level? A few decades ago, when I was in school, cholesterol level up to 300 was considered dead, not a bad thing. No one really knew their levels because people didn't have them checked. And 300 level is essentially okay, right? I considered cholesterol levels at that time at 300 to be totally fine. Actually, 225 would be outstandingly perfect. Today, in order to sell more drugs, pharmaceutical companies and physicians are trying to get you to believe differently, that your cholesterol level should be below 150. The truth is, if that cholesterol levels were that low, we would have tons of dangerous disease processes and dysfunctions occur. Not a good thing. A cholesterol level under 150 is worse than a cholesterol level above 300. Far worse. We've got to really understand the mechanism. If you want to make sure that things are good, your omega fatty acids, making sure your liver works well, get the garbage out of your diet. I love a Mediterranean diet. I mean a real Mediterranean diet. Tons of vegetables, a little bit of protein, nuts, seeds, things of that nature, right? Really learn how to take care of yourself. Don't take the statins. Not without really being in a jeopardous situation. I'm here every week for you. bringing you things that should spur you, should make you think. Again, do your homework. Listen to the experts, not the medical community. I'll see you next week. Bye.